Welcome to part 2 of this lecture. Let's now consider HIV specifically. How do we estimate its prevalence? One approach would be to test every person in a population. We could use this information to determine precisely the exact number of people living with HIV. However, this is clearly not feasible. A different approach would be to collect and test blood samples from a randomly selected sample of the population and estimate the overall HIV prevalence from this. This would give an unbiased estimate of the prevalence, but it may be difficult to do as the resources required may be substantial. This may particularly be an issue in settings where the prevalence is low, and so a large number of samples would be needed to be tested to obtain reliable estimates. It is therefore more common to test blood samples that have already been collected for other purposes. Examples include the samples that may be collected when an individual attends a genitourinary medicine clinic, or blood that is taken for blood donation services. If we are able to assume that the sample of individuals in whom blood is drawn is fully representative of the population we are interested in, then the prevalence seen in this sample will be a good, unbiased estimate of the HIV prevalence of the entire population. In practice, however, the individuals included in these studies may not be fully representative. The prevalence estimate may need to be weighted so it is more accurately reflecting the situation in the wider population. As well as the prevalence of HIV, we would also like to have an estimate of the incidence. How might we do this? The measurement of HIV incidence is generally more complicated. This is because we often do not know exactly when an individual became HIV positive. As an example, imagine we wish to estimate the incidence of HIV in 2015. We could consider all those who were diagnosed with HIV during that year. However, it is difficult to establish whether these individuals acquired their HIV infection in 2015 or in previous years. Therefore, calculating the incidence in any given year is not straightforward. In addition, a large number of individuals are currently unaware of their HIV status, and so are also unknown to surveillance teams. As a result, HIV incidence rates are generally estimated using either mathematical models or using a statistical method known as back calculation. Back calculation works by recreating the number of new infections that must have occurred in the past to generate the current levels of diagnoses. In some instances, where a population is fixed, it may also be possible to estimate incidence through changes in the prevalence over time. Therefore, although new diagnosis rates are often used as a proxy for incidence, they may follow very different trends. Whereas trends in incidence will reflect changes in sexual risk and drug-injecting behaviour, or the uptake of public health measures to reduce transmission risk in a population over time, trends in new diagnoses also reflect the success of testing campaigns and interventions. In part 3 of this lecture, we'll take what we have learnt and consider the epidemiology of HIV in Europe.